the way we're designed to provide medical care here is not a system of well care. It is not a system where we're rewarding people for keeping patients up and healthy, right?
Right.
So it's funny because even when I bill insurance, right, I can't bill for acupuncture if somebody's coming in for maintenance or just because they want to keep feeling good. They have to have a diagnosis that I'm actually working on.
Wow.
And that's from the insurance company.
Yeah.
Now, the insurance company also knows that it's cheaper for somebody to come to me for every week and have them give me $150 a session than it is for them to go and get an MRI once.
Hi, everyone. This is Diane Gilman, formerly known as the Queen of Genes, but now the proud host of my podcast, Too Young to Be Old, named after my second book. And we have with us today a fascinating gentleman, Dr. Tom Ingegno. He happens to be the host of his own podcast entitled Irreverent Health. And today we're going to talk about what modern medicine feels is irreverent: cupping, red light therapy, acupuncture, and cryotherapy. All of these he is an expert in as alternative approaches to aging better and living with less pain. And Dr. Tom, I would like to say, I have found that the classical decisions medicine makes, like they told me the other day, oh, well, you should be discussing knee replacement. No, on a scale of 1 to 100 for pain, if I get that gel shot, my pain is down to like 2 out of 100. But there is this constant need to feed the hospital systems. And so I do want to say, when I saw your bio, which we get on everybody before we decide who's going to be on the podcast, I said to my assistant, who's half my age, my social media manager, I said, cupping? Oh my God, that is medieval. The only time I ever saw cupping was watching a movie done in 1966 by Roman Polanski with Sharon Tate in it, called The Fearless Vampire Slayers, or Fearless Vampire Killers, depending on what country you're in. And this guy arrives in Transylvania and he's got like traveler's fatigue, and he forces his assistant, Roman Polanski, to cup his back. And I thought, oh, no, no one's ever doing that to me. Talk to me about how you do it, the benefits of it, and why it is so incredibly popular today. My social media manager was like, oh my God, Diane, you are so ignorant about this. You know, it's like, I didn't know that it was one of the most popular forms of spa purchase on Groupon. Talk to me about cupping.
So you know, it's amazing where something that's over 4,000 years old is finally getting its moment in the sun, you know.
Yeah.
And it's one of the things that I love about it is, you know, thousands of years ago we thought we were all isolated little, you know, it's this country or that area or this tribe or that tribe, and cupping made it all over the civilized world. And to the point where we're not exactly sure where it came from. We have a text in Egypt that's 1515 BC that talks a lot about cupping. It's a medical text called the Ebers Papyrus. We know that it was being done by Hippocrates, so he was the father of modern medicine, right? And we know that it was all over Persia. So we're not exactly sure who had it first, but we know that it kind of went out around the world from there, made its way down to Africa, you know, west to Europe, east to Russia, China, and all of Asia, and then somehow magically, even the Aztecs were doing it. in South America. And here we go. Oh, we don't know how they figured it out. Was this one of those things where they co-discovered something? And while it was not fully in use, it would come in and out, right? It's funny that we call Western medicine traditional medicine, but we have these practices that have been around for thousands of years that we like, oh, that's alternative. No, that was first.
Yeah, right.
But with this, we know that we have, when we talk about any kind of effective medicine, we have some compliance. One of my favorite things, I know you're in New York. I used to teach at Pacific College of Oriental Medicine. It was by the Flatiron Building when I was there. Every time I taught cupping, all of the international students, the first thing they would say to me is, Grandma used to do this. Right. So it was always a folk remedy. It was always in the hands of the households. And that's what I really love about it. Like, can we return this therapy back to people, put it in their hands and allow them to take care of themselves and their family and friends at home? Right. And look, you'll always need me. Maybe you'll need some more intense treatment. Maybe you'll like the way I do it at the office better. But if you can take care of those little bumps and bruises and you can get your blood flowing and get some good circulation to an area and get some inflammation out of things like knee issues, low back pain, neck and shoulder pain, you can really help.
Are you telling me I could actually do cupping on my knee?
You would go around the knee. So, and part of the thing is when we use glass cups in a clinical setting or hard cups, they don't fit on bendy parts so well. It's just you need a flat surface to adhere
parts,
them.
Right.
But now, especially with the home sets, a lot of them are made out of silicone. Some of the plastic cups actually have a curve, so you can adhere it to an area that curves. And you can get circulation around it. Well, I wouldn't say cup directly on the knee, above it in the quads, below it in the calf, right? To open up and get circulation through the knee is what we're trying to do.
Now, what I use, and I actually got it from another guest who came on the podcast, was red light therapy.
Yeah, love that.
And I use that. But when you go to talk to an orthopedist about it, because their particular hospital doesn't do that.
Yeah.
And
they can't bill for it.
Money off of that. They profess to have, they're like, oh, red light therapy. Yeah. I don't really know anything about that. I'm like, come on. You must.
And it's funny because I do a lot of these services in my office. We have a red light bed, and people would say, well, you're an acupuncturist. You practice East Asian medicine. How does that fit in? And one of the things that I always loved about East Asian medicine was even cupping wasn't Chinese in origin. We took it, but thousands of years ago. But within that, we don't want to discredit things. We want to be inclusive, right? So we pick up herbs from around the world that are not native to China, and they're part of Chinese medicine. So when I started studying red light, I said, well, this reduces inflammation, it increases circulation, it helps tissue repair. Well, that sounds like everything I learned in East Asian medicine. So how is that not East Asian medicine? So when we incorporated that into the clinic, it's because it sounded like acupuncture to me. And it wasn't just this new thing because it's got 40 plus years of research on it. The field is called photobiomodulation, if you want to get a mouthful right there. But it basically means light affecting the body. We're altering the body through light. And go ahead, please. I'm cutting you off there.
I'm going to say that for me, it really works. I believe it works. And I'm not sure it works because I believe in it, or it actually works and that's why I believe in it. Because when it comes to my doctor, my orthopedist, and it comes to even my physical therapist, they both poo-poo it.
Well, we can look at clinical research here. And when when we talk about evidence-based medicine, everybody goes, oh, it's got to be these great studies. Yes, we want good studies, but there's two other components. There's practitioner experience, right? Does the practitioner have experience? If they don't, well, evidence-based medicine goes away because you don't have that circle in that Venn diagram. But also what the patient wants. right? And if we're talking about putting some red light bulbs on your knee for 20 minutes a day or something like that, and that makes you feel better, you wouldn't take that away without the research, but the
Yeah.
research is pretty clear that it does actually help, right? And it does this. It's the same red light that you would get in the morning sun or during a sunset, right?
Oh.
That golden hour time,
Oh.
right? And with that, some of them are a little savvier and they have some light bulbs that look like they're out, and that's the near infrared that penetrates a little bit deeper. But those cells in your body all have, and this is seventh grade biology, have mitochondria in it, the powerhouse of the cell. It needs oxygen. It needs nutrients to run the cycle to make that ATP, that cellular energy. Well, it gets stimulated by that red spectrum light. So what happens is we're telling those cells, hey, make more energy when it gets exposed to that light. And that's where that repair function comes from. That's where that increased circulation comes from. That's where that cellular energy comes from. And we love that because with some weird exclusions, that's applicable for almost everyone.
Yeah.
Yeah,
I now use it on my shoulder as
Yeah.
well because I had all my lymph nodes removed and I've got lymphedema in my left arm.
Mhm.
And what I found is less swelling from the
Yeah.
lymphedema, which was really, really exaggerated for about 2.5, 3 years after the surgery. And you stopped using your arm. So you
Mhm.
stop raising your arm above your head, which you really need to do. So I use it as much as I can down my arm. And I found it worked. Now, if I had my dream come true,
Mhm.
I would have, what is that oxygen chamber thing that
A
Michael
hyperbaric chamber.
Jackson used?
A hyperbaric
Oh,
chamber.
yeah, I want one of those in my home.
We
Please.
used to have one at the office, and it's funny because the soft chamber ones, the ones that are made out of a heavy vinyl, are for home use. But unless you go to a big hospital that has a decompression chamber or you get massive third-degree burns, you're not getting in one of
Ever.
those. They won't even let you pay for it. It's like
Ever.
$40K a session.
Yeah.
But within that, we swapped our hyperbaric chamber for something we call that's called exercise with oxygen therapy. So it's to like get oxygen into your body quickly, right? Your red blood cells are only ever going to hold 100% oxygen. You can't get more oxygen on those red blood cells. They bond to the little iron molecules in the middle of those red blood cells. But the liquid part of your blood, you can store a lot of oxygen in. So with hyperbaric, an hour in a home unit, that's about, like, they call it a dive because it mimics going, scuba diving, is about 15 feet underwater, where you get about 30% more oxygen into your body, right? And that's floating around free in the system, and it'll, oxidize bad stuff floating in your blood, but every cell it bumps into picks that up. So you get more oxygen to the tissue, which is how you get this healing. Now, what this company that we have for exercise with oxygen therapy says, well, that's an hour. It lasts in your body for 3 hours after that, and it's only about 30% extra oxygen. Exercise with oxygen therapy, they make some crazy claims. And I had to talk to a respiratory physiologist. I was like, I don't believe you. They're claiming up to 433% more oxygen into the bloodstream for up to 3 days after a 15 to 20-minute
I
ride.
have to ask you something.
Yeah.
Does that make you feel high, like you've just smoked a lot of weed or something? I mean, I just want to know.
It's a heady sensation. You're much more functional than, say, if you smoked a lot of weed. But there is a mellowness, right? I remember watching, Nova. Remember Nova on PBS? It was such a great
Yeah.
show. And they did one on nurse sharks. And God, how this is such a weird memory and so random, Diane. But they were talking about them resting in areas that had fresh water coming in, and blowing through their gills because the fresh water had more oxygen, and it would get them kind of dopey. So I think you're onto
Wow.
something there where it's like you do feel a little bit of an oxygen high from it.
Yeah.
But one of the things that we use it for in the office is like clearly reduce inflammation. We use it for traumatic brain injury. We use it,
Wow.
yeah, some people use it for autism. I mean, these are all off-label things. It's sold as a performance enhancement piece of equipment, but we're using it more medically, you
But
know?
with a lot of solutions like cupping, red light therapy, acupuncture,
Yeah.
and cryotherapy, you're talking about being able to live out your years, your
Mhm.
60s, your 70s, your 80s, possibly a lot closer to pain free
Yeah.
than you ever imagined. Because to me, old age is a completely different territory from
Mhm.
middle age, from premenopause to postmenopause. Old age is its own deal. And if you can delete some of the aches and pains, it completely liberates your mind. I mean,
Absolutely.
it's a mood enhancer beyond. So I'm so interested. Cryotherapy. What?
Ah.
Oh, that sounds really uncomfortable.
Uh, so we added probably about 2 years ago a cold plunge because some people were saying they didn't get the rush from the cryotherapy, which is insane because cryotherapy, for the nuts and bolts of it, you stand in a chamber in your underwear for up to 3 minutes, getting blasted with air that's been cooled with liquid nitrogen. It starts at -184 Fahrenheit. Most chambers go up to -260 around there. And the whole reason you don't get frostbite or burnt is because it's dry, right? So you can't
Oh,
have water like weird stuff, Diane. I can't let you in there if you have lotion on your body. If you just went for a run and you're sweaty, you can't go in the chamber because sweat will freeze. Oils will freeze. So with these little safety protocols, and we give you gloves and booties, and your head is out of the machine in ours. Some of them are closed. They give you a mask. Um, within that, in that 3 minutes, what happens is the cold squeezes your body. It wrings you out like a sponge, right? Everything tightens, the skin, fascia, muscles, forces the blood back to the trunk of the body. And what it's doing is it's driving out inflammation, whether that's cytokines, anything that's stuck in the blood that doesn't need to be there, right? So it's wringing that out like a sponge. And what happens is your body's physiology, when you step out of that chamber, it wants to warm back up.
yeah.
So all the blood vessels open back up, and now you have this blood that's been, cleaned up, liver, kidneys, every way in the core of the body. It's picked up oxygen from the lungs, nutrients from the gut that's shooting back out. So on one hand, we're rapidly reducing inflammation to help with pain. On the other hand, we're helping with repair as that blood's coming back out. So this is another service that people are like, "Oh, I just started hearing about that." I've got a cousin, he's a personal trainer who trains celebrities out in LA. And he came up to me at one of our cousins' weddings and he goes, "Hey man, you got to get one of these." And that was probably about 2015 and I already had the order in, so we had a great conversation. And he goes, "It's brand new." And I go, "Actually, it was invented in 1978 in Japan." It's not new, but these things are coming around now because exactly to your point, we don't want to age and be unable. It's not this like let's live forever as children.
Yeah,
It's how can I be functioning at every stage of my life?
exactly. And it is extremely, and I know this because every other part of my body is completely vital
Mhm.
except my right knee, which whatever has arthritis in it, whatever. And it really messes up your life. I mean, when you don't have mobility,
Yeah.
you don't have anything. When you don't have a sense of well being and health, you don't have anything. And I'm going to say that you have got a medical alternative boutique practice because even in a super sophisticated city like Manhattan, New
Mhm.
York, I'm absolutely blown away that I cannot go into a hospital setting like
Mhm.
Mount Sinai and say, "Oh, yeah, I would like a cryotherapy
Yeah.
session today," or "I would like a red light therapy session." They do not even, and I think they put out bulletins the way political parties pull out bulletins.
Mhm.
Here's your talking points for this week, right? I think they do. And they say, you can't talk about red light therapy because we don't have it. We don't want it. We can't make money off of it. Why do you think that giant mechanisms like these huge hospitals don't offer these alternatives? You know, I might feel safer as a
Mhm.
I don't want to say customer, as okay, a patient. I
Yeah.
hate using that word because it implies illness, but
Yeah.
why
I think
can't
that's a
that?
fundamental issue right there. I think you kinda hit it on the head, right? The way we're designed to provide medical care here is not a system of well care. It is not a system where we're rewarding people for keeping patients up and healthy, right?
Right.
So it's funny because even when I bill insurance, right, I can't bill for acupuncture if somebody's coming in for maintenance or just because they want to keep feeling good. They have to have a diagnosis that I'm actually working on,
Wow.
and that's from the insurance company.
Yeah.
Now, the insurance company also knows that it's cheaper for somebody to come to me for every week and have them give me 150 bucks a session than it is for them to go and get an MRI once. You know, so it's not a cost thing. I think it's a control thing, and I hate being that conspiracy theorist there.
You know, I'll tell you a really interesting story that's sort of a side story, but it kind of proves the point.
Hmm.
So I had to get a full body MRI before I started cancer treatment. And I'm very claustrophobic.
Mm.
And so I said, I'm not getting into one of those machines. Diane, you have to. We can't begin treatment without it. I said, well, do you have a bariatric MRI
Unit, yeah, yeah.
or with people over 600 pounds? And they did. And that was interesting to me at the hospital that they'll service something like an 800-pound person and do that surgery on their stomach, but they won't turn around with somebody like me and discuss after treatment diet,
Hmm.
after treatment exercise, after treatment supportive alternative therapies like red light or like acupuncture or like cryotherapy or like that oxygen thing that I want in my
Ah.
house today. Um, why do you think that is? Because if I was in a hospital setting, like I
Mhm.
just said, and I have to think of myself as a patient, but you may think of going into old age as actually a condition. Um, I would feel okay about getting red light therapy
Yeah.
or cryotherapy from a hospital setting, and I am amazed that they do not take advantage of that. Is that because the people that administer it don't have full medical degrees? What is the hang up there?
It's an interesting thing because even down here, we have, we have some of the best hospitals. I'm in Baltimore. We have Johns Hopkins, University of
Oh,
Maryland, and
yeah.
all these places, right? And certainly New York, we can name a ton as well there. It doesn't seem like even when they talk about having a complementary program, there's almost like a gatekeeper to that, like an integrative health department,
Ah,
where it's like, oh, you don't get that. Why? Oh, that's for RA. That's for this specific condition. And what do? Oh, well, they do acupuncture. Well, what about all these other things? Right. And even if we look at food in a hospital, right, it's not necessarily put together by a nutritionist, it's put together by a dietitian. Here's the calories in
Yes.
these boxes, right? So you look at some of the foods they're eating, and I have a friend who's God, he's got to be pushing 80 now. He was a gynecologist, and he said he used to make this joke. He's like, "Yeah, we learned about nutrition in school, but I was in the bathroom, so I missed the whole thing." It's funny because a lot of classical therapies, especially acupuncture, there's physicians throughout history that were acupuncturists that would say things like diet and lifestyle modifications first. If that doesn't work, that's when you do acupuncture, give
Wow.
Chinese herbs, right? Because this concept and what we're talking about is as aging and being healthy through aging, they call yang shen in Chinese, nourishing life. So it's about setting up your lifestyle for that. And it was funny, sometimes I go like, look, I've got a doctorate, I've got a master's degree, all in healthcare. I don't have the MD, which I think still depresses my parents a little bit. But yeah, I was looking at what else could I do? Do I want to go back to school one more time just because you can't have enough student debt apparently? But I found this doctorate in lifestyle medicine. And I went, well, what's that? So I started reading it and I'm like, wait a minute. You're convincing people to go to school to tell other people, hey, get 8 hours of sleep. Here's what a balanced diet looks like. Hey, move your body. And I was like, how far removed have we on one hand, we're living longer than we ever have. We have more abilities and treatments and all this technology to help us, and yet we're missing the basic things that this is how you take care of a
But
human.
that's that we have more things to cope with it because we actually have more diseases.
Yes,
And I was reading that cancer has jumped 77% this year in
and
a
in younger
wrong
people.
direction amongst younger people.
Yes.
I know 2 or 3 younger people now that have just within the last couple of months been diagnosed with cancer. And then there was a report on CNN about diet and how they found that if you are of a generation or part of the country where it's really a fresh food desert
Hmm.
and you're left eating fast foods, like let's say 3/4 of your diet is McDonald's or
Hmm.
some such, you will actually have a lower IQ, a much higher BMI, and a much lower chance of aging into your old age. And you're going to age with problems. And I
Yeah,
always thought to
absolutely.
myself, all the chemicals in those foods that your body doesn't even recognize, doesn't even know how to process those forever chemicals. They probably sit there forever in your body and then cause cancer. Um, I personally feel from friends of mine who are in their late 40s, early 50s, and still have kids at home
Hmm.
because you can now get pregnant later in life. Those children will never even know what a whole chicken is
Yeah.
or a cow. They only see it as Chick-fil-A, right? Chicken
Hmm.
McNuggets,
Yeah.
and there's no history behind the food. And so you're also, I think, your taste buds get completely attuned to really high sodium
Yeah.
and chemicals that bring out the flavor or are the flavor. And I think the more disassociated we get from authentic food sources, like the
Mm.
other day, so I had a guest on who worked with the FDA and came up with the terminology for foods, cage for chickens, let's say cage free, free
Hmm.
range, and none of this means anything. It just
No,
means
not at all.
the poor things either have 8 square inches and that's their entire life, or they have 12 square inches. So I got really on it about reading labels. So I bought some chicken that was cage free, pasture fed, know
Mhm.
this, know that, got to eat fresh seeds. And I could not believe the difference, not even just the flavor, the consistency of the meat, the flesh itself. It was mind blowing. So it seems to me two things. When I went to Mount Sinai, one thing I was very excited about with the treatment for breast cancer was you got your own dietitian. But that was just about not eating things like salad bar where bacteria could grow from thinning out. I thought it was going to be this whole thing about here's
here's the diet for you.
Yeah, here's
A
the
nutrient-rich
nutrients
diet.
you need to work with chemotherapy. And then they have up in the Great Hall of Mount Sinai Hospital on Fifth Avenue what to me are like Moses delivering the tablets of good living. And it is things like don't drink hard alcohol, don't smoke cigarettes. But it also surprised me. Don't eat red meat.
Yeah, and I think even there, you know, some of those studies are very biased because they're factory farm meats, right? This is not, you know, not something that's been out eating grass its whole life. You know, in its natural environment, it's very much like chickens. How many can we fit in here? What can we feed them to fatten them up? Like,
And
you
a
know,
lot of hormones too.
a lot of hormones. And a lot of those things, and I think a lot of times when we talk about cancers and stuff, is xenoestrogens. So that's foreign estrogens coming from other sources.
Absolutely.
Really do play into that. And when we're doing these things to fatten up animals and getting them to quote unquote mature enough to slaughter, it's really against our best interests.
Totally.
You know,
But, you know, I went and I must eat red meat like at this point, maybe once every 6 months. So I see from Fresh Direct, which is how I get my food delivered in New York City, there's filet mignon and it's absolutely no GMOs. Free range, like never lives inside. Eats nothing but pasture grass, leads a happy life as a happy cow. So, okay, I'm going to order one for me because I'm celebrating something. I don't know. And $54.95 a pound. So, in closing, does that mean that if you want high grade food with the least amount of deleterious chemicals and hormones and fat, if you want supportive alternative next step medicine like cupping, red light therapy, cryogenics, acupuncture, you have to be of a moneyed class that can afford
it is.
How unfair is that?
You know, unfortunately, you know, there's so many movies I could name, The Hunger Games, things like that, where it's like this is the society that we're living in. Granted, that's a fantasy scale, but yeah, you know, and this is part of the reason I wrote the cupping book because look, you're going to pay for the cups, you're going to pay for the book, but after that, you know, hopefully you have a method that you can take care of yourself and friends and family you know, without having to outlay much expense. You know, I watched this one inventor, and he invented a way to test for malaria, and he used kids' toys to develop a thing that would cost less than $2. And his whole thing was every time we add a zero to that number, we exponentially cut out a population of the globe that can afford those things. And this is why I'm so passionate about a lot of these traditional therapies, because they weren't physician driven. They weren't part of the medical system. They were done at home before you sought medical care. Right. So if those are the things that we can promote to keep people living longer, healthier lives, and you know, hopefully we see this return to, like, you know, the farmer you're getting the stuff from too.
Yeah,
because
I'm
at the
working
root,
on that personally because I want to say that the food is different. It's far superior and it tastes a lot more like I believe it tasted, because I'm 78, so obviously I was born at a time where none of these forever chemicals or preservatives were
Yeah.
in food, and there was no fast food. It takes me back to my youth and how food used to taste. My mother, we were Jewish, and my mother used to take me to a kosher butcher. So these guys all have yarmulkes on, right? And they're all running around, and it's totally chaotic in there. And there's chickens running around, and you ask for a chicken, and they got the chicken and cut its head off and took the feathers off, and there was your
Yeah.
dinner. And boy, did that taste different
Yeah.
than like, and don't get me wrong, I love KFC. I mean, I would be a total fast food junkie on stuff like fried chicken if I would
Yeah.
allow myself, which I never will. But I wish there were more of you, Dr. Tom, because you are incredible. So,
Thank you.
Dr. Tom Ingegno, it's not how your name is really spelled, but it's how you say it.
You're phonetically nailing it, and that's what's
You are
important.
very kind. This was an incredible podcast. It is all about people learning as you age and cherry picking what is going to work for you. And you get to a point around 55 or 60 where you have to start educating yourself and working with your body rather than against it. And also, not always choosing surgery and knee replacement and hip replacement as your first choice,
Mm.
but rather trying to use acupuncture or cryotherapy. And I know I'm waiting for the shipment of the oxygen machine to come to my door.
I
That's going to
gotcha.
be if anybody asks me what I want for Christmas, that's it. For sure. Cryotherapy, I don't know if I'm all good for that
Well,
cold blood.
I'm originally from New York. If you need some recommendations for places, let me know.
And I will. Okay. You know what? Dr. Tom, thank you so much. This is one of the most informative
Oh, thank you.
for baby boomers podcasts we've ever done. Thank
Oh,
you. You're
thank you. Thank you. It
great.
was my honor to be here. Thank you.
Thank you so much for listening to Too Young to Be Old podcast. The episode may be over, but the fun doesn't have to stop here. Find us on Facebook, Instagram, TikTok, and YouTube at The Diane Gilman, or visit our website, thedianegilman.com. If you like the show, leave us a rating or a review and subscribe so you don't miss the next episode. And until then, don't forget, age is just a number. Together, we'll prove that we are all too young to be old.